If you have epilepsy, you might notice that your pills are changing with time, or you might be getting a generic form of your anti-seizure medications different than the brand name that your doctor prescribed. Is this a problem with anti-seizure medications, that you're using generic forms rather than the brand form that you were getting originally? Today we will answer this question in detail. The generic medications were approved by the American FDA in the year 1984. And at that time, they recommended that the new generic medication has to be in similar concentration to the brand name by 90%, which means if we give a generic form, let's say levetiracetam, the blood concentration should be similar to Keppra, which is the brand name of the same medication. And the numbers should be anywhere in between 0.8 all the way to 1.25. So anywhere in between those ranges, the medication will be accepted as a generic substitution to the medication. All generics should have the same active ingredients, and the difference usually is in between the support structure and the other additives to the pill formation. Generic medications are much cheaper than brand names, and they can be having advantage in cases of patients be able to afford them, have much lower co-pays for their medications, and for public insurance and other countries to be able to afford those medications for all the people in the country, and people are being covered by this insurance plan. A recent study showed a shocking increase in the prices of the brand names and brand medications by about 277% in the last 10 years or so. The cost of brand names went from $2,800 in the year 2010 all the way to $10,700 in the year 2018. At the same time period, the cost of generic medications dropped from $800 per year in 2010 all the way down to $400 a year in 2018. So there is a huge difference in the cost between generic and brand names of the same medication. And this massive increase in the prices of the brand names were mostly driven by the one brand medication, which is Vimpat, or the medication lacosamide. And luckily now it is available as a generic form, and the prices are very, very affordable. The concern with anti-seizure medications in the generic form is that some medications have a tight therapeutic window, and if you drop below that window, then you might have seizure breakthroughs theoretically, or if you go above that therapeutic window, then you might get into toxicity. And let's say some of the tight therapeutic windows medications like phenytoin or dilantin, this medication is very tightly regulated, and if we drop to like 0.8, we might get into seizure breakthroughs, or if we get to 1.25, we might get into some toxicity. But luckily now most of the anti-seizure medications have a much wider therapeutic window, and if you would say that they're like more forgiving in the term of the seizure medication blood levels and the efficacy and the control of seizures. Let me know down in the comments, have your pharmacy been changing your prescription into generic forms? To be complete and comprehensive, yes, there are some reports and anecdotal evidence of people who were having breakthrough seizures when switched from the brand name into the generic forms. However, this concept was tested in multiple clinical trials, and that did not show any significant difference between the generic forms and the brand name. So at the end of the day, there is no significant difference between the generic form of anti-seizure medications and the brand form of anti-seizure medications. Both of them have the same active ingredient. However, we should always be aware that there might be some slight differences in the concentration of those medications. So what we do is that if we switch from a brand to generic form, we should first measure the blood levels before doing the switch, and then repeating the blood levels after 2 to 3 weeks, so that we make sure that there is no significant drop or increase in the blood levels, and we maintain the same blood levels for the patient during that time. And if needed, we can adjust either by increase slightly or decrease slightly to maintain the same levels, so that the patient will not suffer any breakthrough seizures or will suffer toxicity with too much medication. And the second recommendation is that if you get generic forms, you should get the same generic form every time you refill the medication. This should be agreed upon between you and your pharmacy so that you get the same generic form, so that you don't get different generics with different concentration. That can also lead into trouble. And to learn more about all the anti-seizure medications and how they work and what is the best medication for you and what are the potential side effects, I put together one video that has all those information. You can see it here, and stay healthy and see you in the next one. Salam.